Hello everyone, we are Group 19, and today we are excited to present our research proposal on science communication ethicals in drugs and health products. This topic explores how ethical communication plays a crucial role in ensuring public trust, informed decision-making, and transparency in the pharmaceutical and healthcare industries. As we navigate an era where misinformation spread rapidly, understanding the ethical dimensions of science communication has ever been more important. Our presentation is structured as follows. We will start with the problem statement, where we outline the key challenges in the fields. Then we will dive into lecture review, summarizing the extinct research and gaps. Next, we will present our research questions, which guide our investigation. This will be followed by our research objectives, setting clear goals for what we aim to achieve. Finally, we will discuss the research methodology, detailing how we plan to approach and address these issues. Let's get started and uncover how ethical communication can shape the future of healthy and pharmaceuticals. Hello everyone, my name is Wu Simiao. First is the problem statement part of our study. This includes how to improve public trust in medicine promotion and public health information in scientific communication while overcoming ethical, transparency, and accuracy issues in current practice. There are significant ethical challenges in current fields of pharmaceutical promotion and scientific communication. These challenges are mainly reflected in following aspects. First is ethical issues in pharmaceutical promotion. Local and multinational pharmaceutical companies show notable differences in ethical practices, particularly in developing countries. Number two is ethical risk in rapid research and development. Coronavirus 19 vaccine development highlights the need to protect research participants' rights and ensure transparent communication while addressing urgent public health demands. And number three is impact of direct-to-consumer pharmaceutical advertising. While this advertising boosts patient initiative, it can lead to drug misunderstandings and strain doctor-patient relationships. And number four is ethical issues in digital health and AI. Digital health tools face major challenges with privacy protection and data transparency and lack a clear ethical framework for practical use. Number five is public health information dissemination. During health crises, the public needs diverse disease and drug information, but current communication channels lack sufficient coverage and effective strategies. This problem not only limits the transparency and credibility of the pharmaceutical industry and scientific communication, but also poses a threat to public health decision-making and patient rights. As competition in the pharmaceutical market grows, ethical promotion has become increasingly important. However, there is little research comparing the ethical practices of local multinational pharmaceutical companies, especially in developing countries. To address this, clear strategies are needed for ethical frameworks, communication standards, and technology use. This can balance business interests with public well-being, improve industry compliance, and build public trust. This study explores key ethical issues in pharmaceutical promotion and their impact on public trust. It examines how scientific communication can help and suggests strategies to improve transparency and compliance. The findings offer theoretical support for better practices in pharmaceutical industry and guidance for policy making.
The goal of communicating about drugs and health products is to build public trust and understanding in health decisions by sharing transparent information. But in today's global market, commercial interests often clash with public health goals. Ethical science communication is shaped by many factors, like advertising, doctor-patient talks, policymaking, and the fast pace of technology and social media. Science communication should focus on accuracy, transparency, fairness, and protecting public interests. Ethic promotion means finding a balance between making money and meeting public health needs. Survey reviewed 10 studies and found that ethical science communication revolves around key ideals like being open, building trust, and managing conflicts of interest. This research focused on four main areas: the ethic challenges in promoting drugs, ethic communication during health crises, and ethic issues on digital and media platforms. These areas face big challenges. Companies sometimes act apparently for profit, vaccine development needs to balance speed with ethics. There are concerns about privacy and data management. And social media can spread false information and raise privacy risks. While current research has covered a lot of ground, it still has some gaps like biased data, lack of practical advice, and not enough focus on long-term effects. So, in short, future research should focus on different cultures and technologies, design well-rounded communication strategies, and develop detailed guidelines to make sure science communication stays accuracy, transparency, and fairness.
Next, I will introduce the section on research questions. When we talk about science communication ethics, especially in the context of drugs and health products, it's clear that this is a complex and sensitive area. To navigate it effectively, we need to start with the right questions. Questions that help us identify and address the key ethical challenges. Today, I want to share some of the most important research questions in this field. First, how can we make sure the information shared about drugs and health products is accurate and transparent? This might seem obvious, but it's a significant challenge. For example, often generate huge amounts of data, but not at all gets shared with the public. We prevent selective reporting, where only the position results are highlighted while risks are downplayed. And how can we ensure that information is presented in a way that's both truthful and easy to understand? Second, how does the way we communicate shape how people think and feel? What matters, for instance, if we describe a drug as 95% effective, it sounds impressive, but if we say 5% of people still get sick, it feels less reassuring. Even though the two statements mean the same thing, researchers are exploring how the framing of messages can impact public trust and decision making. How can we strike the right balance, especially when we are communicating uncertainty or potential risks? Third, what happens when commercial interests come into play? Companies spend billions on marketing, and their messaging can blur the line between education and promotion. This raises ethical questions. How do we make sure that evidence-based, unbiased information isn't overshadowed by persuade advertising? And should there be clearly guidelines to separate marketing from function communication? First, how can we make sure everyone has access to accurate information? This is especially important for people who might have limited health literature or who rely on sources that spread misinformation. Studies show that unreserved communicators are often the most affected by misleading health claims. What strategies can we use to ensure that all groups, no matter their background, have the tools to make informed decisions? Finally, who is responsible when things go wrong, and how do we hold them accountable? If misinformation leads to harm, whether it's from a misleading advertisement or poorly worded scientific statement, who takes responsibility? Should there be penalties for spreading false or biased information, or should we focus on creating incentives for ethical communication practice? These questions are at the heart of research in this area. They help us uncover the gaps and find ways to improve how we share information about drugs and health products. More importantly, they remind us that ethical communication is not just about sharing facts. It is about building trust, promoting fairness, and ultimately protecting public health.
Next, I will present my research objective, which focuses on enhancing transparency, building trust, and addressing ethical challenges in science communication to improve public health decisions and policies. In the modern era, science communication is becoming increasingly complex, especially in medical field. Challenges arise in areas such as drug promotion, vaccine development, digital health, social media communication direct to consumer, advertising and reporting on medical cannabis. These challenges raise critical ethical concerns, influencing not only public behavior, but also the formulation of effective health policies. The main objective of our research is to tackle these challenges by improving the quality of health communication, promoting medical transparency, and leveraging ethical intelligence. Through these efforts, the research aims to ensure that health information is accurate, accessible, and impactful, empowering the public to make informed health decisions. By doing so, these studies aim to enhance the overall quality of science communication, foster trust in research and policy, and contribute to social health. Our research is structured around 5 key areas. The first one is medical and public health, addressing ethical issues in reporting and promoting trust in public health decisions. The second one is health communication and digital media, explore how digital tools and platforms can enhance the effectiveness of health communication. The third one is artificial intelligence and data management, investigating how AI technologies can optimize the delivery and algorithm of science communication. The fourth one is crisis management and public engagement, analyzing changing information needs during crises, such as pandemics, and improving the effectiveness of communication strategies during these critical times. The last one is medical transparency, developing approaches to increase transparency in medical research and health policies, ultimately building public trust. This research promotes science communication by improving medical transparency, optimizing health communication, and applying artificial intelligence. The goal is to enhance public understanding of health communication, ensure its accuracy, and encourage active participation in health decisions. The study will improve science communication quality, build public trust in research and policy, and support social health.
Hello, here is Linjing. Now let's continue to the methodologies. Our focus here is to uncover the ethical challenges and the communication strategies in pharmaceuticals and health products by examining how these studies approached the topic. To begin, let's look at the general methodological framework adopted by the studies we reviewed. These include cross-sectional studies like Go et al., which collected data through surveys in multiple cities, systematic reviews, such as Limbo and Human, which synthesized global data to identify recurring issues, narrative reviews like Wibawa, focusing on the meta-analysis of existing literature. Mixed method studies, exemplified by Heinrich and Holmes, combining qualitative and quantitative approaches. And content analysis, like Gunning and Eels, which analyze media coverage of health topics. These studies use diverse data sources, ranging from surveys and interviews to media content and academic databases, giving us a comprehensive picture of the field. Here's a breakdown of the methodologies employed in the studies we analyzed. For instance, Go et al. Conducted a cross-sectional study using surveys across 7 cities, employing descriptive statistics and regression analysis to identify disparities between multinational and national companies. On the other hand, Weibawa took a more qualitative approach with a narrative review, synthesizing themes from the literature. Systematic reviews like those by DeFrank et al. And Limbu and Human relied on extensive database searches and thematic analysis to draw global insights. Lastly, Gunning and Eels performed content analysis on 216 news articles, applying statistical tests to explore the ethical framing of pharmaceutical topics. Each methodology contributed unique insights, which I'll elaborate on in the following slides. Let's take a closer look at the key methods and why they matter. Quantitative approaches. For example, Go et al. Used statistical analysis to highlight ethical disparities in the pharmaceutical sector. Second, qualitative approaches. Heinrich and Holmes provided valuable insights into public needs during pandemics through surveys and focus groups. The third, review-based studies. Limbu and Human synthesized global data to identify critical ethical issues in pharmaceutical marketing. Each of these approaches addresses different angles of science communication ethics, contributing to a richer understanding of the field. Despite the methodological diversity, we notice some recurring themes. The importance of transparency in science communication, ethical challenges such as conflicts of interest, privacy issues, and misinformation, tools used to identify public needs and improve engagement. However, these studies also had limitations. For example, Francer et al. Highlighted geographic and cultural biases, while Go et al. Pointed out a lack of longitudinal studies. These gaps present opportunities for further research. While these methodologies provide valuable insights, they are not without limitations. Many studies relied on self-reported data, which can introduce bias. There's a notable lack of research focusing on developing countries, as highlighted by Francer et al. Additionally, studies like Gunning and Eels didn't fully address the role of digital and social media platforms, which are increasingly important in today's communication landscape. These limitations underscore the need for more inclusive and innovative approaches. In a word, the methodologies we reviewed highlights the ethical challenges and communication strategies in the pharmaceutical industry, with recurring themes like transparency and public trust. Moving forward, Our research aims to bridge the gap between ethical principles and practical strategies, contributing to more effective and responsible science communication. That's our proposal. Thank you.